I'm Tara. I work as a PT at the Pawtucket location.
Hi, my name is Ange. I'm a physical therapist at the Cranston location. Toddling to me is just practicing at the top of the license, being your best self every day for all of your patients, showing up and just being there, learning as much as you can, as often as you can, whether it be from other people, from patients, or just doing a bunch of research. Toddling feels like that light bulb moment for your patients when they actually understand what they're doing, why they're doing it, and why they're feeling better because of it.
I think it's like such a great point you were bringing up, the doing research and everything, just because we are like so early in our career. So I think like a huge part for us too is just recognizing like our own limitations and that we're not going to know everything, and that's okay. But like recognizing that you have resources that you can refer to be able to practice at the top of the license, so you're giving people the best care possible.
I felt pretty lost. When I first started, I felt like not confident when I was talking to my patients just by myself, especially being a new grad, and knowing that that's normal as a new grad to not be super confident with what you're doing is scary at first, especially for people who are like type A perfectionists. But I feel like resources like your clinic directors, your clinic managers, your site coordinators, just other PTs that you have and mentors are super, super, super important to use. And I feel like a lot of new grads feel like they have to stop using them after like their 6-month period. But using them for as long as you can is so super helpful.
Definitely. I'd like having as much support as possible is like the biggest thing. I'm like super grateful that I practice in a really large clinic because I just have so many people I can refer to when I have any questions. But yeah, like definitely the transition from being a student to then being a practitioner, and like before when you're in the room with your CI and doing the thing, and now you have to do it on your own, and you realize when you look over and there's nobody else there and you're like, oh, this is all on me now and I have to figure it out. It's definitely very different. So for support that I've had in my career, so for one, I've had my clinic director because we meet weekly, which is very nice. I also have my clinical instructor that I had when I was a student, so I can still refer to her from time to time. And then you're also assigned a mentor. I know I was, I assume you were too. Yeah, so you have all those people who are already like assigned to you, and you know you can reach out to them for support. But it's also just like everybody's friendly, like you can talk to anybody. They're all going to be helpful and answer your question, and they're going to be understanding because they were in the same position you were once. So really, the whole clinic is your resource, but they just want to make sure that you have all the support you need, so you already have people assigned to you specifically.
Plus, like you have like your exercise specialists too who are going through school, or most likely going through school for PT. So a lot of times, like I'll have conversations with them, or I'll be like, "Oh, I'm thinking about doing an exercise for this. Like, any ideas from you? Like, this is what I was thinking." And just like that new blood learning is really helpful. Like, because you get stuck in a rut sometimes after like a year of just practicing. You're like, "Oh, I'm low back pain." Like, same thing again and again, but site coordinators too, I feel like I rely so heavily on, especially with like insurances and going through intake paperwork and all that type of stuff.
Definitely. And also just like the other students who are there on their clinicals. Like I remember when I was a student, there were just things like everybody goes to different schools and learns things a little bit differently. And there were things I were doing and practicing PTs of like, I've never done that before. Can you show that to me? And then there were students there at the same time I was, and they were doing things different. And we were like just talking about how we all had different backgrounds, but that there's not one right approach to everything.
Yeah, absolutely.
So the mentorship program was helpful early on because I think it just made really clear what goals were in mind. So it was like a weekly meeting and you had certain prompts that you had to discuss. So you always knew kind of what was expected of you for the week and also what you were working towards. So I think just like having a clear overall goal in mind is really helpful when you're first starting out, because there's just, you might have so many goals for yourself that it's overwhelming. So when someone gives you like a very set, like for this week specifically, we're gonna work on A, B, and C. And that's very, very helpful when you're first starting out and just kind of honing in on a few certain things.
Absolutely. I was placed with a mentor for sports-specific things, so it was helpful to like, even now, like a year out, just learning like, oh, what are you doing there? Like, oh, can we go through this protocol? Oh, I have this patient, can we share them? Stuff like that is super helpful. Plus, like I have 2 CIs that are now Highbar employees, so it's it's helpful to like just Teams message them and be like, hey, I have a question, like, hey, can you help me, along with the other people that we have in the clinic.
Teaching versus like mentoring and coaching, like I definitely think of teaching more as putting the onus on the instructor themselves versus the student. So the student might be a little bit more passive, like the instructor is taking on more of the act of passing on the information, demonstrating, and the student is a little bit more just taking in. There's less responsibility for them to come and ask questions, for them to recognize what topics need improvement.
Definitely. And then I feel like coaching is more of that, like watching the PT do it or the student and then correcting or guiding or keeping them on the right path as they like either fail and learn or succeed and learn or figure out where to make changes, stuff like that.
Yeah. I think coaching would be a little bit more two-way. Like it's not going to be all on the instructor to be like, this is what you need to work on. It's going to be a little bit more give and take. I do think it's a little bit more goal focused, like maybe the student would recognize that they have a goal that they want to work on, and then the instructor is going to help them realize how do we attain that specific goal. And then mentoring, last one. I feel like mentoring is just like ongoing forever. Like you just never, like you just never stop. It's also like that is also more give and take than teaching would be, but it's just like you never stop learning. Like you're always going to be growing professionally. You're always going to be growing as a clinician. So having someone to lean on a little bit to see where you're going to grow next, I think is really important.
Definitely. That mentoring, like you said, like never ends. Plus, I feel like it's the two-way learning. So the mentor could be learning from the mentee, and the mentee can be learning from the mentor. Plus, the mentor usually has gone through that process already. So they've been there. They know, like, okay, here's what worked for me. Here's what might work for you, what might not. Here are your options. Kind of guiding more on that path of like, let's figure this out together, rather than you figure it out and let me know.
Teaching, I would say, so mentoring, like we were saying, mentoring you do always. Yeah. I feel like, and you're always kind of a mentor and you're always kind of a mentee. Like you're never going to be at the top of the top, so you're always giving some advice and you're always taking some advice a little bit. Teaching might be, like as new grads right now, we're probably a little bit more on the receiving end of the teaching. Not that we don't teach as well, but definitely a little bit more on the receiving end. But like once you do things like take a student, you're going to be more of a teacher than yourself. And that's also like, you never fully stop teaching, but there's probably going to be phases of teaching. And then I feel like coaching is when you probably have something really specific that you want to work towards, or when you're really coaching a patient. Like they're like, I want to, run faster because I want to run the marathon and I want to make the Boston qualifier. And so like coaching a patient in order to do that and having a specific goal to work towards is really important.
I think we're never done using those aspects of PT. Like I still go to my mentor for almost everything, but knowing when to go to her is important as well. So I've gone to her a lot less as we've continued. I'm like, okay, so I have this problem, let me try a thing or two, and then look back and be like, hey, I tried this, not really seeing a lot of improvement. Any suggestions, any ideas? And more on that coaching end with the patient, and then referring to more of like the research, and then referring to your mentor, or even with clinic directors too, just like knowing when an administrative question needs to go to the clinic director rather than knowing if it needs to go towards your site coordinator or if you can figure it out yourself, stuff like that.
Yeah, I also think like another point too is that it's not like there are three separate entities, they kind of flow together as well. Absolutely. So you might do something where you're a little bit more of a teacher, but then, so you're doing a little bit more of the front loading of the work, but then you might ask more questions and just be like, where do you want to go from here? Where do you see yourself utilizing this skill? And that's going to flow more into maybe the mentorship side of things. So it's not like they're three totally separate things, like it's a little bit of a blend and you're never going to rely solely on one at a time.
Absolutely.
Why did I choose Highbar? That's a great question. So I did my very last rotation here as a student. I guess a little bit of background on me. I went to University of Pittsburgh for PT school and I had done all of my previous clinicals out there, so I knew I wanted to see somewhere totally new, and I just really liked seeing somewhere totally new. I thought it was a really good location to start because of the support, which I talked about before. I really like being in a large clinic. I always kind of saw myself practicing in a larger clinic just because I like working around a lot of people and having a lot of support. So it just felt like a really good fit to start at because they have so much support for newer grads and people who are just starting out.
I graduated from Springfield College about a year ago. I am from New York, so I was like, okay, change of pace, I need it. I did my last rotation at a Highbar, a little north of here, and then kind of fell in love with just the way even the higher ups in the company are just like treating their clinicians, and the support that they're given is so incredible. Like even it's day to day, whether it's between the CEO or just chief officers, everybody. Plus my first CI, who I kind of like learned the most from, I'd say, she became a new clinic director at like a brand new clinic at Highbar, and I was like, okay, that's a sign that like I need to be here, because I feel just, it makes me feel at home knowing that like my first CI, who I was the closest with, was here, and then my last CI was also here, who I was also close with. So it just kind of like, it was a good fit for the way I wanted to practice as well. Just that potato is like how I go about practicing, and it's not for everybody, but the people at Highbar, I feel like it definitely is.